Welcome to APIC's 2021 Virtual Awards Show. Today is actually our first ever virtual awards, and we'd like to welcome everybody.
Hey, Devin, it is such a pleasure to be hosting this with you.
Likewise, Anne-Marie, and in typical pandemic fashion, we're doing this whole thing via Zoom.
Oh, I know, and we're all pretty good at Zoom by now. So wish we could all be meeting in person, but honestly, Zoom is the next best thing. And the APIC Virtual Annual Conference is spectacular. And then the good news is that we are finally emerging from the pandemic.
After 15 months of just everything being virtual, it just sure feels great to have a little bit of normalcy in our life again.
Yeah, I don't know about you, Devin, but I am thrilled to be here to honor our colleagues who've received awards for their dedication and their commitment to infection prevention and control.
I agree, Anne-Marie. It's an honor to recognize those who have made such a difference to our profession and our field. And because the conference was canceled in 2020, we're doing double duty today, giving shout outs to both our 2020 and 2021 award recipients. So we have quite a show for all of you today, 56 awards in total, I'm told.
You know, and to your point, quite a bit of work goes into the whole awards process. So I'd really like to acknowledge the research committee, the conference abstract committee, and certainly the nominating and awards committee for all their work in reviewing submissions and then selecting these award recipients.
That's right, Anne-Marie. The incredible work of our volunteers never ceases to amaze me. And so without further ado, let's get on with the show.
It is now my privilege to present awards to two healthcare leaders who have been pivotal in establishing an organizational culture that enables and supports infection prevention efforts. The 2020 Healthcare Administrator Award goes to Dr. Gail Thurman. Gail is Senior Vice President of Clinical Effectiveness and Chief Quality and Patient Safety Officer for Methodist Le Bonheur Healthcare in Memphis, and is now a member of the APIC Board of Directors. And Gail believes that healthcare providers at all levels, including physicians, nursing, ancillary teams, vendors, frontline associates, all must make patient safety a top priority. And for this reason, she advocates tirelessly for IPC-related funding, training, technology, regulatory compliance, and to carefully monitor the efficacy of clinical and quality improvement projects. So congratulations, Dr. Gail Thurman.
Yay! Yay, Gail! Yes! Yay, Gail!
Well deserved, and I wish you all the best and congratulations.
Your tireless leadership makes a difference in improving patient outcomes. I really appreciate your tenacity and your support. Congratulations on this well-deserved honor for the 2020 APIC Healthcare Administrator Award.
Now on to the 2021 recipient of APIC's Healthcare Administrator Award, Ms. Darla Perdue. Under Ms. Perdue's leadership as Chief Clinical Officer for Vibra Healthcare, IPC became an organizational priority. And in 2017, she actually added a VP of infection control position to the corporate clinical team. That is amazing. And by doing this, she established the importance and the value of infection prevention within the organization. She also developed a standardized orientation process for new infection preventionists to ensure that they have the training and the skills that they need to succeed. All of these efforts have led to sizable reductions in healthcare-associated infection rates. So congratulations, Darla Perdue.
Darla, congratulations on being such an excellent leader and helping Vibra Healthcare get to the point that we are at and all of the successes we have seen with reducing infections across our company. This is a fantastic award and you are so deserving of it.
Congratulations, Darla Purdue, for receiving the 2021 Healthcare Administrator Award.
Now it is my privilege to introduce the recipient of the 2020 Distinguished Scientist Award, Dr. Nasia Safdar. This honor recognizes those who have made an outstanding contribution to the science of infection prevention and control. Dr. Safdar is a professor in the Division of Infectious Disease at the University of Wisconsin School of Medicine and Public Health. She is vice chair for research in the Department of Medicine and the medical director of infection control at UW Hospital and Clinics. Pretty busy, I would say. Her research focuses on identifying, testing, and implementing novel interventions to prevent HAIs, such as the use of probiotics for reducing colonization by MRSA and Clostridioides difficile. She leads the fecal bacteriotherapy program at UW Hospital, and she is the principal investigator for trials assessing fecal microbiota transplantation as an intervention to reduce HAIs. This recipient has numerous awards. She can now add APIC Distinguished Scientist Award to her list of accolades. So congratulations, Dr. Nasia Safdar.
Nasia, I'm so thankful that I have had the opportunity to know you personally, professionally, and academically. You are so prolific, but very humble, and you know the balance between challenging and demanding. Long live Safdar's Research Group! Congratulations, Nasia.
So next up, we have a special treat. We have a video to honor our very first APIC Shea Award recipient for their lifetime contribution to the field of infection prevention and epidemiology. This award recipient absolutely needs no introduction, as you'll see. So let's play the video.
I am profoundly humbled and grateful to be honored by the Association for Professionals in Infection Control and the Society for Healthcare Epidemiology of America with the APIC Shea Award for lifetime contribution to the field of infection prevention and epidemiology. I came to know David decades ago through our NIH collaboration during the difficult early years of the HIV pandemic. It is heartening to realize how much progress we have made against HIV/AIDS since then, but sobering to once again be grappling with a novel pathogenic virus of extraordinary global consequence that we are just beginning to understand. As you all know, we coexist with a microbial world that includes established and newly emerging pathogens that, if left undetected and unchecked, can cause humans a spectrum of misery, illness, and death. The important work of infection preventists and healthcare epidemiologists like yourselves in detecting and tracing outbreaks and implementing infection control programs in our hospitals and in our communities has long been underappreciated for its contributions to our well-being as individuals and societies. With the emergence of the COVID-19 pandemic, what you do has been the bedrock of our COVID-19 mitigation efforts. Your life-saving work, although generally behind the scenes, has been pivotal to our efforts to lessen harm and to help us bring this pandemic under control. COVID-19 clearly has taught us how important it is to have robust infection prevention programs in our nation's healthcare facilities, headed by people with your specialized skills and expertise. So thank you again for this distinguished honor and for what you do every day to help us stay safe. We will end the COVID-19 pandemic, and your contributions will play a key role in that. Keep well, and I wish you all the best as you continue your outstanding work.
So we owe Dr. Fauci a huge debt of gratitude for his tireless work and dedication this past year. Thank you, Dr. Fauci. Next up is also something very special, the inaugural presentation of the Emerging Leader in Infection Prevention and Control Award. This new award recognizes new IPs who have demonstrated a commitment to the field and to their professional growth. We are thrilled to recognize Benjamin Galvin as the 2021 recipient of this award. Ben has been an active APIC member since 2016, and he has showcased his innovative and collaborative skill set, as well as his dedication to the infection prevention profession. Currently, he is an IP at Tampa General Hospital. His drive and commitment to improving healthcare was very evident in the performance improvement projects which he's managed and contributed to while he's been at Advocate Aurora Health's Illinois Masonic Medical Center in Chicago. These projects brought about impressive outcomes, such as a significant reduction in county events, a reinvigorated hand hygiene compliance program, and a culture shift towards shared accountability with hospital cleanliness. Ben also helped design and implement a mobile phone app that actually improved data collection and streamlined the auditing process for indwelling medical devices at 2 medical centers within the Advocate Aurora system. And in addition, Ben is currently pursuing a Master's of Public Health with a concentration in infection control at the University of South Florida. He serves on the National APIC Communications Committee, and he's an active member of the Florida Bay Area APIC Chapter's Social Media Committee. Ben Galvin is passionate about advocating for medical technologists as being equally suited candidates for new infection prevention positions, and he is determined to further his knowledge and ability to drive collaborative process change while improving patient outcomes within his new facility. Congrats, Ben. We are very proud of you.
Woohoo, Ben! Congratulations!
Congratulations, Ben. So proud of you.
Many congratulations, Ben. We are very happy for you and very well deserved.
I don't think anyone else deserves this award more than you do. I appreciate all the hard work that you've done working in our department, and I'm just excited to see what the future has in hold for you.
So up next are the President's Distinguished Service Awards, honoring the work of Patricia Lynch, who is one of APIC's pioneering members, and actually its first national president. So we have Patricia Gray, who is the 2020 recipient of the President's Distinguished Service Award. Patty is an on-call consultant for Honor Health in Scottsdale, Arizona, having previously served the same health system as network director of IPC before retiring in 2018. Patty has been an APIC member for more than 25 years and has held APIC office positions locally with the APIC Grand Canyon chapter, as well as nationally as chair of APIC's Public Policy Committee. She has advocated tirelessly for recognition of the infection preventionist's essential role in patient safety, drafting APIC comments to federal agencies and tackling issues from PPE to medical device reprocessing to Medicare quality reporting programs. Patty, thank you for all your work and congratulations, so well deserved.
Part of the reason why I'm here today is because Patty was my mentor.
She was the experienced infection preventionist. When I came into the role, I was brand spanking new. So I had the fortune to be mentored by her, and always patient, and loves to teach.
Patty, I am so proud of you for receiving the President's Distinguished Service Award. I can't imagine someone more deserving who's had such a quiet impact from behind the scenes, but a huge and profound impact to me professionally. And I'm just grateful for your service for the past 25 years. I'm grateful that you continue to serve even in your retirement, and can't think of anyone more deserving than you.
Patty, I feel you're so deserving of this award. I nominated you for this several years ago, and in that time frame, you've since retired, and we've kept your application alive, and you won it in 2020, the pandemic year when our conference was canceled. It's been a long time coming, and it is well deserved.
I can't think of a better person to receive it. I wish you all the best. Wish it could be in real life, but it will be soon.
And now to our 2021 awardee for the President's Distinguished Service Award, Dr. Terry Redman. As a teacher, expert, and leader on bioterrorism, disaster response, and infectious diseases, Terry's contributions to APIC have been numerous. In addition to her role as professor and special assistant to the president at St. Louis University, Terry is also a member of APIC's COVID-19 task force, and in this capacity, she has worked tirelessly to ensure that APIC members and other stakeholders, including nurses, understood changing guidance on transmission of SARS-CoV-2 and PPE, of which there's been many. So before COVID, if any of us can remember that, she was a member of APIC's National Ebola Task Force, and she was chair of APIC's National Emergency Preparedness Committee, where she directed development of pivotal APIC position papers on disaster preparedness. Terry currently sits on the Civic Board of Directors and is a former member of the APIC editorial board. As her many nominators have noted, because of Terry's efforts, APIC is a stronger organization, and quite honestly, the world is a safer place. So Terry, this is so well deserved. We thank you and we congratulate you.
It's always really fulfilling to work with Terry. She is really good at making sure that everybody in a group is included.
She's always up to a challenge. She will never tell you no.
Unafraid to take on a new challenge, unafraid to commiserate with other experts and to ask the hard questions.
She's a very good teacher. She will stop and say, well, if we approach the problem this way or we use this method, it might come across better.
So she's a wonderful example of one of the lesser known and lesser celebrated, but certainly no less important portions of infection prevention.
I'm so happy that you're receiving the Distinguished President's Award this year.
Terry, thank you. This award is so well deserved.
You are a credit to nursing, infection prevention and control, education, humanity, and the future. Congratulations.
It's now my honor to present APIC's Carol DeMille Achievement Award. This is truly APIC's Lifetime Achievement Award, and it honors an infection preventionist whose contributions have improved the practice of infection prevention through research, performance improvement, visionary leadership, and community service. The 2020 Carol DeMille Achievement Award goes to Linda Green of the University of Rochester Highland Hospital in Rochester, New York, and a former APIC president. This award is annually given to an IP who best exemplifies the ideals of Carol DeMille, who was absolutely a pioneer in our field. As an APIC member since 1988, Linda has had extensive experience in IPC in the acute care setting, long-term care, and ambulatory care. She has held leadership roles in her APIC local chapter, of which I'm a member, a proud member, before becoming a member of the APIC Board of Directors in 2010. She served as secretary and then APIC president in 2017. And during the 2014 Ebola crisis, Linda served as a national media spokesperson for APIC. And she participated in media interviews, press briefings, and message development. Linda was also president of the board for APIC Consulting Services, and she continues to serve APIC and the IPC profession in so many ways, including as an advisor and contributor to APIC position papers and implementation guides, as the APIC representative to the 2020 CDC Decennial Steering Committee, as well as a frequent presenter regionally, nationally, and at international conferences. Linda, what can I say? I am so proud of you and so honored to be your colleague. So thank you for your immense contributions to APIC and congratulations on receiving this amazing honor. So deserved. Linda has been my colleague and friend for many years.
I've known Linda since the early 80s, before we were both in infection control.
I've known Linda for about 20 years.
She is very insightful.
She knows how to do strategery.
Linda is somebody who makes challenging tasks seem so easy.
She is committed. She likes to have fun.
She knows how to collaborate with others. She can do her own assignment, but she loves to receive feedback about it and also then to contribute to the whole product.
Linda she's very dynamic, very smart.
I have never, in I can't even tell you how many decades, heard Linda say no. It's always a positive experience, and she really knows how to make things fun.
I can always pick up the phone and call her and run something by her to get her perspective.
She is able to connect with infection preventionists because of her level of expertise, but also because she continues to work in the field herself. And I think that just really resonates with our IP professionals.
Whether it's at the local level, the state level, the national level, or the international level, she's so collaborative in her approach.
She is probably one of the reasons I became an infection preventionist.
Linda, I salute you and I congratulate you. You've received the highest honor in our career and in our profession, and you are so deserving. And we just thank you. Each and every one of us in infection prevention thanks you for your leadership and just the role model that you've been. So thank you.
Thank you so much for being who you are and for always being there for the infection prevention and control community, especially in New York State and especially for me.
You've selflessly contributed to APIC and beyond, but more importantly, you have saved many, many, many lives.
Congratulations, Linda.
Congratulations to you.
Congratulations.
Can I say one thing to Devin before he starts?
Please.
You look like 007 and you look so calm, cool, and collected. I'm so jealous. Anyways, 007 hit it.
All right. Now we'd like to honor our colleagues who have contributed to the profession through their research. These are our IPs who are innovating the practice of infection prevention and control through their work. First up are the Blue Ribbon Abstract Awards. These awards are presented to a limited number of abstracts considered to be of exemplary quality. The 2020 Blue Ribbon Abstract Awards go to Nicole Russo, Michael Statura, and Jingjing Shang.
Well deserved.
And we are honored to present the 2021 Blue Ribbon Abstract Awards to Mendy Livingston, Patrick Palmieri, Hanako Masao, and Holly Taylor. Congratulations to our 2020 and 2021 Blue Ribbon Abstract Awardees.
Way to go!
The new Investigator Abstract Award recognizes outstanding research conducted by an APIC member who is directing a study for the first time. Congratulations to the 2020 recipient Randall Collins and to the 2021 recipient Kathy Alton. Fantastic work.
Congratulations, job well done. Woohoo!
The Best International Abstract Award spotlights research within an international healthcare community. The 2020 recipient is Carly Rebello. Let's hear it for Carly. Congratulations.
Yay! You won!
The Implementation Science Abstract Award recognizes an abstract that promotes the integration of research findings and evidence into healthcare policy and practice. Implementation science is at the heart of what IPs do, taking the evidence and applying it at the bedside. The 2020 Implementation Science Award recipient is Jennifer Burrell, and in 2021, this award goes to Fazia Steinpiller. Great work and congratulations to both of you.
Excellent job. Woo!
Next up is the APIC Graduate Student Award, which was established to further the research of infection prevention and to support a student who is seeking to complete a master's or doctoral degree. The 2020 APIC Graduate Student Award recipient is Linda McKinley. Linda's research focused on daily environmental cleaning in acute and long-term care Veterans Administration facilities. This work was very personal for Linda as her brother, Eric Williams Fredericks, passed away in May of 2021 from diabetic complications and chronic osteomyelitis that developed following a surgical site infection. She dedicated her dissertation to the life of her brother. Our hearts and our prayers are with you and your family, Linda, during this difficult time. Next is the William Rutala Abstract Award. This award recognizes excellence in addressing the subject of disinfection, sterilization, or antisepsis. We couldn't have infection control without a grasp of these critical subjects. It's my honor to present this year's award to Michelle Osborne. Congratulations to Michelle.
Congratulations, great job.
The Award for Publication Excellence recognizes a paper published in the American Journal of Infection Control, which was widely read and cited during the previous year. We're pleased to honor 2 such articles. Our award recipients for this 2020 award include Dr. Karen Gugliano, Dr. Dion Baker, and Barbara Quinn. Congratulations to this wonderful writing team. I'm also pleased to announce that the 2021 recipients of the APIC Publication Excellence Award include Nunu Sun, Lequan Wei, and Suling Shi. Thank you for your contribution to our profession, and congratulations on your publication.
Congratulations to the best of the bunch.
And now on to our Film Festival Awards. This next awardee actually has a special place in my heart. Prior to coming to APIC as CEO, I served as the CEO for the American College Health Association. And this awardee was one of our special members. The pandemic may have worn us down, but it could not crush the IP ingenuity and creativity as exhibited by our film festival submissions. The films are not only delightful to watch, but they also contain solid education messages for healthcare personnel. The 2020 APIC Film Festival Grand Prize goes to my friends at the University of Arizona Campus Health Service for their film titled Hand Wash Lately.
Don't forget those thumbs. You're so
circus is fine. When the circus is fine. Soap and scrub a little longer. Soap and scrub a little longer. Don't want infected outy line. No infected outy line. Soap 'em, baby now. Soap 'em, baby. Soap 'em, baby now. Soap and scrub. Soap 'em, baby now. Soap 'em, baby.
Take one. Congratulations! You did it! Great video!
The 2021 Grand Prize goes to Asbury Methodist Village Wilson Healthcare Center, located in Gaithersburg, Maryland, for their film Hindsight is 2020. And boy, isn't it.
Hindsight is 2020. What we need to learn from the past year. 2020 is the know-how about the dreaded SARS-CoV-2, also known as COVID-19 and other infectious agents, in order to break the chain of infection. But first, we need to understand the 6 links of this chain, namely infectious agents. Viruses such as COVID-19, bacteria, or parasites are known as pathogens or germs that cause disease.
Congratulations to those at the Wilson Healthcare Center for earning this prestigious award. It just happened that I was a patient there and I noticed how careful you all were during the pandemic. So kudos to you.
Devin, what are you doing with that mask on? We're in the middle of an awards ceremony.
Oh, well, there's so much fun here and excitement. I thought it was contagious. And so I decided to put a mask on at the break. But, the problem is now, Emery, I've got so many of these things at the house. I don't know what I'm going to do. I was thinking about maybe taking up origami and trying to do something like that today.
Hey, Devin, I've got an idea. How about I knit you a sweater, sort of an early Christmas gift? How would that be?
Totally. It would go a long way.
We're on to the Heroes of Infection Prevention Award, which honors infection preventionists who have successfully reduced infection, raised awareness, and improved the health and well-being of patients, healthcare workers, as well as the public. This award is supported by a grant from BD, one of our amazing APIC strategic partners. This program has recognized more than 100 individuals and groups for their exceptional work in reducing HAIs. It is truly an honor to recognize the following heroes of infection prevention. When Ascension, Wisconsin integrated 4 healthcare systems as one, Brenda Ellert's vision and collaborative approach united the organization's multiple, independent, and diverse infection prevention and control programs. It was her leadership which generated a standardized, outcomes-driven IPC program that has dramatically reduced HAIs, actually across the whole system. To standardize practice and optimize resources across the market, leaders formed an infection prevention council that includes reps from all 4 legacy healthcare systems. This outcomes-driven group guides development, prioritization, implementation, as well as measurement of HAI reduction across AW. And they work to ensure that the organization aligns to Ascension's national guidelines. Within the council, work groups addressed specific HAIs, assigning leads from across the market to spur ownership, accountability, and creativity. Brenda's leadership, along with the committed work of her council, has resulted in consistent reductions in multiple HAIs across the AW system. The AW team's work has also supported Ascension's national program targeting best practices for standardization. This work has paid off during COVID-19 for sure, because they were able to share staff across facilities and implement consistent protocols. So important. Such great work. Congratulations, Brenda.
Brenda, I want to congratulate you from the bottom of my heart for receiving the 2020 APIC Heroes Leadership Award. I can't think of anybody more deserving. You emulate all that this award represents. And I just want to say congratulations. Well deserved, well earned.
Our next heroes, the IPC team at Northside Hospital Gwinnett Medical Center, dramatically increased understanding about the integral role of infection prevention across their facilities and decreased HAIs. As the new leader for Gwinnett Medical Center IPC's department, Darlene Carey consciously built a diverse team who could help transform the perception of infection prevention at the 553-bed hospital from being seen as punitive to being one seen as readily available, providing resources and support to the staff and help them find areas of improvement. One of the new team's first actions was to launch an HAI prevention committee with representation and involvement from partners across the facility, including clinical managers and physicians. The committee identified actionable items and outlined processes for implementation and follow-up. As they educated and guided staff throughout the hospital to address priority HAIs, the IPC team focused relentlessly on creating a collaborative mindset and approach. The team also engendered trust by evaluating the impact of new IPC projects before launching them. Over 3 years, the team created numerous meaningful changes. These included significant decreases in the overall number of HAIs at Gwinnett Medical Center, and the standardized infection rate also dropped. The trust and collaboration they have built throughout the system have contributed greatly to the sustained progress. Such great teamwork, and congratulations, way to go.
Congratulations! Woo! I just want to congratulate the team at the Gwinnett campus. You guys are amazing heroes every day. And quite honestly, all of you are my heroes.
On we go to our next award, which goes to the infection prevention team at Emory University Hospital, Midtown. They leveraged their diverse, complementary expertise and a relentless focus on relationship building to enhance perception of the IPC function at their facility and to reduce HAI rates. In 2018, the newly restructured Emory Midtown IPC team set a goal to increase both their visibility and their partnership with the hospital's clinical units. Relationship building became a guiding principle for the department, starting with ensuring that relationships within the IPC team were strong. As the first non-nurse infection preventionist at Emory, Jill Holdsworth saw value in diverse IPC team and sought candidates with a variety of backgrounds. All team members participated in interviews to ensure that the new hires would be a good fit, and the resulting team works exceptionally well together now. This relationship-focused approach was applied to the broader organization as well, and the IPC team conducts daily rounding on all units, actively engaging with their frontline team members. This team created an HAI-focused multidisciplinary steering committee with the IPC team members and nurses co-leading specific HAI reduction groups. These groups develop and implement standardized apparent cause HAI analysis templates to identify common failure modes and implement corresponding targeted interventions. Since this approach was implemented, Emory Midtown has achieved significant HAI reductions, including a 50% decrease in catheter-associated urinary tract infections. Importantly, the organizational perspective of the IPC function has improved significantly. That is so exciting to me. So it's clear that teamwork makes the dream work, as they say, and congratulations to this incredible team.
I wish every patient that touches our facility knew what you do on a day-to-day basis. Maybe one day they will, but you've reduced patient harm and our employees are safer because of what you do. So thank you. Thank you so much for what you do.
That's such inspiring work, Anne-Marie. Our next Heroes Award goes to the IPC team at Regions Hospital. This team created an integrated multidisciplinary program to improve infection prevention practice across their facility. These improvements generated sustained infection reductions across their entire system. As part of the Broad Region's hospital improvement effort, which kicked off in 2015, the 6-person infection prevention team at this large safety net facility launched a comprehensive program to reduce healthcare-associated C. diff infection rates. Following a gap analysis in literature and guidelines review, the C. diff prevention team decided to focus their efforts on environmental cleaning and disinfection, as well as determining when C. diff testing is appropriate. The hospital's Environmental Services, EVS director, was appointed as the project's process owner. This unique approach helped create a different level of engagement and accountability. Over the next 33 months, the team systematically implemented tactics to reduce environmental C. diff exposure, including nurse and provider education, EVS staff education and training in the hospital simulation lab, a patient safety risk dashboard, and a regular report for nurse managers. On the testing front, the team revised protocols, initiated ongoing staff education, and adjusted nursing workflow, including the introduction of a 2-nurse review process for specimen collection. Information technology staff modified the hospital's electronic health record systems to support appropriate test ordering. The team reviewed compliance and process improvement progress at weekly meetings and guided partly by a multidisciplinary case review. From 2015 through 2018, healthcare-associated C. diff infection rates declined 46%, staggering, and unnecessary or inappropriate testing declined 53%. This is amazing work, and congratulations to this talented team.
Well, I'd like to thank the team. They've instilled confidence that we can deliver, care with zero harm. Most important. I want to thank the team for a record of 7 years of improvement and sustainment in an area that's very difficult. I want to thank the team and the organizational pride that this work has brought forward and making us really feel confident that we can continue to do this type of work in other areas. And I want to thank the team for reinforcing the fact that if you bring will to improve, if you bring a thoughtful design where you don't take on world hunger, and you support others in leading work outside of the areas of their expertise, we can do wonderful things together.
And our next talented team of heroes is from Westchester Medical Center. They adopted and integrated a first-of-its-kind IPC technology, leading the way for transformation of current IPC surveillance and practice. Responding to a request from New York Medical College, the 5-person WMC team provided patient samples to fuel development of the first adaptive intelligence genomic-based platform for identifying and mitigating healthcare-associated infections. I am impressed already. Once the tool was created, the team worked diligently to integrate it into the IPC workflow at their 652-bed network hospital. This visionary team was the first to advance genomics for pathogen monitoring from the research world into real-world IPC practice. They've also benefited the entire infection prevention field by disseminating their knowledge through publications and presentations. This new app looks at culture isolates genetically, compares them consistently across time and hospital location, and alerts staff to any possible clusters. Users can, as the WMC team has done, apply the genomic analysis, then to assess potential transmission routes and explore underlying causes through analysis and investigation. This tool helps them see the facility as a whole to identify patterns. Oh my goodness, this is amazing. And that really takes surveillance to a whole new level.
I am pleased to present the 2020 Heroes of Infection Prevention Award for IPC Operations to my team, Westchester Medical Center Infection Prevention Team. Congratulations.
What amazing work. Our next team, Kelly West and Craig Gilliam, partnered to identify and investigate and help address a Serratia marcescens bacteria, despite their facilities being more than 1,000 miles apart. In early 2018, Kelly West noted that 4 blood cultures in her facility had tested positive for the bacteria, which was notable because they typically see 1 to 3 positive cultures a year and instead had 2 in January alone. In addition to initiating an investigation at her facility, Kelly shared this with her pediatric IPC network to alert others and enlist their support and insight. Craig Gilliam of St. Jude's picked up on this post right away. He recalled a very similar bacterial case at his facility, and after reviewing his data, he found 3 recent cases that looked very similar and connected with Kelly. Genomic typing showed that the bacteria at Craig's Tennessee-based facility matched those at Children's Hospital, Colorado. By systematically cross-referencing the products used by infected patients at both facilities, Kelly and Craig identified pre-filled heparin syringes as the likely culprit. In addition to working with their internal teams to pull the syringes, they partnered with their state health departments and engaged the CDC to address the problem nationally. Their keen insight and outbreak investigation skills provided the data necessary for federal partners to initiate a product recall. Kelly and Craig emphasized the importance of external networking and collaboration for timely identification of IPC issues. Without the ability to reach out to trusted colleagues nationally, they would not have been able to put the pieces of this outbreak together. Wow, talk about the power of a national network of IPs.
Hi, Kelly and Craig. I've known both of you for a very long time. I admire your work. I admire your expertise. Very proud to see that pediatric IPs were able to once again save patient lives. Congratulations to you both on receiving this award.
Hats off to Kelly West and Craig Gilliam. Congratulations. So our next hero takes us outside the United States all the way to Riyadh, Saudi Arabia. Khalid Al-Nafi paired his interest in information technology with his passion for IPC to actually transform IP systems and processes at his 1,000-bed hospital. Khalid spent his first 5 years at King Faisal Specialist Hospital and Research Center in the pathology lab. When a colleague suggested that he consider switching to IPC, Khalid said he opened the APIC website and fell in love. As he learned the ropes on the hospital's IPC team, he identified ways to streamline and enhance processes and get rid of the sticky notes. 2 years later, the hospital's fully automated IPC system went live. Khalid and his team then began to work on an IPC dashboard. A year later, they launched a fully integrated information system that enables efficient daily workflow while providing, among other data points, live hand hygiene compliance rates, fit test validity, transmission-based precaution percentage, device-associated infection rates, and real-time data analysis. Khalid's understanding of both IPC clinical practice and computer technology made him the ideal person to spearhead these projects. This dual expertise was invaluable during the COVID-19 pandemic. As the hospital scrambled to manage its caseload, Khalid and his team assessed information priorities and then were able to rapidly create corresponding programs for supply monitoring, staff respiratory expertise, and patient and staff COVID-19 demographics. Invaluable. This structure and reassurance that these systems provided increased IPC awareness and compliance across the hospital, as well as enhancing the department's visibility and their reputation. Beyond the impactful systems that he's created, Khalid is recognized as a hospital leader and a mentor. He tells his colleagues that with teamwork and trust, everything is achievable.
Absolutely, and the incredible value of having multidisciplinary IPC teams. Congratulations, Khalid, and thank you for the outstanding achievements.
APIC, thank you so much for honoring me for this award. It's always like what you said, spreading knowledge, preventing infection. Thank you so much.
Our next hero of infection control, Lisa Sturm, is the Senior Director of Infection Prevention for Ascension. one of the United States' largest health systems. Lisa built a system-wide IPC program that has connected and engaged IPs at 150 Ascension locations nationwide, enabling them to reduce targeted HAIs and mount an effective response to the COVID-19 pandemic. When she started in her newly created position at Ascension 4 years ago, Lisa built a national IPC program and community from the ground up using systems thinking approach. She prioritized collaboration and created structures to support it, including an internal website and a chat forum for all 160 Ascension IP staff, and a bi-weekly national IPC community call that is regularly attended by more than 100 infection preventionists. Lisa has also worked to ensure Ascension's IPs feel empowered and confident. She encourages them to trust themselves and never underestimate the value of what they bring to the table. Under her watch, Ascension has recorded decreases in multiple HAIs. To target central line bloodstream infections, she led a multidisciplinary team that standardized the placement and care of lines, creating a guideline for best practices, established competencies, and partnered with frontline teams. They logged a 38% reduction in CLAPSIs over 3 years. In early 2020, Lisa's program enabled Ascension's IPs to effectively organize and standardize their approach to COVID. The foundation that was already in place helped them to hit the ground running. Congratulations, Lisa.
Well, Lisa, congratulations. This is a wonderful award. You deserve it. Honestly, I would say you deserve even a better award if there's any. I'm so lucky and privileged to be someone who partners with you, works with you, learns from you. You've been a great addition for our system, Ascension. You've been a wonderful leader for all infection preventionists within Ascension and nationally. I'm so privileged to be someone who knows you as a partner at work and a friend. Thank you again, Lisa.
Lisa, I just want to tell you on behalf of myself and on Ascension leadership, how proud we are of you, all the work you've accomplished, and all the great things that you've done over the past year. We are so excited to have you as part of our team and look forward to working with you for years to come.
Next up is a duo who partnered to develop an unprecedented infection prevention quality management program that is helping an entire industry recover from the COVID-19 crisis. Jeremy Gibson Rourke and Leslie Lloyd both work at the global risk management organization, Det Norske Veritas, providing IPC quality management and certification services to hospital systems globally. In 2019, they developed DNV's certification in infection prevention program. When the COVID-19 pandemic began, DNV's maritime division sought their expertise to develop IPC quality standards for the severely impacted cruise line industry. While many cruise lines had robust pathogen-specific management guidelines, for example, gastrointestinal diseases, we've all heard about the norovirus problems, the industry did not have broad guiding principles for infection control quality management. To meet this challenge, Leslie and Jeremy did not have to start from scratch. They were able to modify the certification and infection prevention program for the maritime industry to meet the urgency of the moment. The DNV team worked to develop a long-term IPC quality management and oversight program that would enable the typically reactive disease and vessel-specific cruise line industry to proactively manage any emerging pathogen. Leslie and Jeremy had to familiarize themselves with global industry-specific guidance and recommendations, as well as the feasibility of certain IPC practices in this non-traditional setting of a cruise ship. The result? CIP Maritime has already enabled multiple cruise and shipping companies to return to operation. Leslie and Jeremy have shared its principles with professionals worldwide through training programs. And according to the duo, IPC strategies should be applied outside hospital walls to prevent infections across industries and move the field forward. So please join me in congratulating Leslie Floyd and Jeremy Gibson Rourke.
Leslie and Jeremy, I am in awe of you and your accomplishments, and I am so proud of the fact that you work with me on my team and that we have just so much that we can accomplish, and I don't think it's that anybody is more worthy of receiving this award than you guys. So congratulations.
Congratulations.
Amazing work and congratulations. Our final Heroes Award goes to the IPC team at Tampa General Hospital. In January of 2019, the IPC team initiated an annual competency-based educational program that helped them mount an effective COVID-19 response with far-reaching benefits. Before the pandemic reached their units in February of 2020, the 9-person TGH IP team had educated more than 8,200 members and providers about fundamental IPC practices, including PPE donning and doffing, disinfection, and hand hygiene. These competencies became an exceptionally valuable baseline for COVID-19. To enhance their hospital's pandemic preparedness, the team rapidly increased trainings and developed new educational resources, including videos, tip sheets, and workflows. But thanks to the previous training that nurses had already had become very good on many of the basics. The IPC team also adopted a divide and conquer approach to tackle the incoming volume of staff questions and requests. Faced with increasing demands for IP assistance from the broader community as well, the TGH team created the TGH Prevention Response Outreach. This service provides consultations to local businesses and organizations, assessing protocols, and providing recommendations and education. Not only did it help to decrease COVID-19 infections, it also helped create rewarding community relationships. The TGH team's annual competency program, coupled with the pandemic-related trainings and education, generated improvements in multiple IPC processes and outcome measures over the past year. Additionally, TGH recorded low occupationally acquired COVID-19 cases, under 2.5%, and their team was able to reach into the community in ways that will really benefit everyone. Congratulations to the Tampa General Hospital IPC team, and a final round of applause for all of our heroes of infection prevention. You're such an inspiration to all of us.
Yay! Woo, 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 woo! You did it! Congratulations! Woo!
I just want to say thank you to the infection prevention team at Tampa General Hospital. This has been quite a year, and I'm so glad that we were together through all of this and making sure that our team members and our patients were safe. And I'd also like to say thank you to all of the infection preventionists globally, because this has been an unprecedented year, and it really showcased and highlighted the importance of our profession.
Next up is a group of awards that are absolutely near and dear to my heart: the Chapter Excellence and Chapter Leader Awards. And honestly, before I ever volunteered with APIC National, I was very committed and active in my own chapter in Rochester, New York. And truly, the chapter networks are vital to our strength as an organization. Nicole Nomides and Susan Dolan, who chair the Nominating Awards Committee, are going to share more. Nicole?
Thanks, Anne-Marie. The APIC chapters represent the lifeblood of the association. This network with more than 100 groups helps our members connect at the local level.
That's right. Our chapters are leading innovative programs in building alliances around the world. Today, we're so excited to recognize the incredible work of APIC's chapters and chapter leaders.
The Chapter Excellence Award recognizes chapters that have aligned their members and resources to support APIC's mission and strategic plan. The following chapters were awarded this distinction in 2020. Dallas-Fort Worth for clinical and professional practice. Memphis for education, communication, and information resources. Intermountain for member support. Minnesota for synergistic alliances. And West Virginia for synergistic alliances.
The 2021 Chapter Excellence Award recipients are San Diego Imperial, Education, Communication, and Information Resources. Greater Atlanta, Education, Communication, and Information Resources. Puget Sound, Synergistic Alliances. West Virginia, Synergistic Alliances. And now, let's highlight our Chapter Leader Award recipients.
The Chapter Leader Award provides an opportunity for chapters to recognize the achievements of a member who has gone above and beyond the call of duty at the local level. The 2020 Chapter Leader Award recipients are Lori Getz with the Indiana chapter, Andrea Harper in New England, Katrina Summerlin with the Oklahoma chapter, Stephanie Tismer in Minnesota, Calvin White with the Dallas-Fort Worth chapter, and Catherine Wilson in Southern New Jersey. Susan, who received this award for 2021?
The 2021 Chapter Leader awardees are Niraja Ganeshraj with the Dallas-Fort Worth chapter, Michelle Schmitz with the Badger, Wisconsin chapter, Kristen M. Smith in New England, and Lance Williamson with the Greater Kansas City chapter.
Congratulations to our 2020 and 2021 Chapter Award recipients. And now back to you, Anne Marie.
So thank you, Nicole and Susan. How inspiring. And congratulations to our amazing and fabulous award recipients that we've honored here today.
Absolutely, Emery. The work of our IPs is truly life-saving and awe-inspiring. I want to express my sincerest gratitude for the work that all of you do every day. For our award winners, we cannot congratulate you enough, and we're so proud of your accomplishments. And thank you to all of our IPs for the countless hours and the personal sacrifices that you made to prevent the spread of COVID-19. You're such a pivotal part to us containing this deadly pandemic, and we cannot thank you enough.
Yes, that's for sure, Devin. And it is truly an honor and a privilege to serve as the APIC president, particularly as we emerge from this amazing pandemic. And as we lead the way forward in elevating the importance of infection prevention and control across all aspects of society. If we've learned anything this year, it's that finally people are embracing the idea and understanding that infection prevention truly is everyone's business.
So as we enter the ninth inning here of our award show, I want to put forward the idea that one of the things we can do is pay it forward for next year's award winners. So I'd like to ask you to please make sure that you're recognizing your peers, put them forward for awards. We'd love to celebrate these accomplishments together. Again, we're so proud of our award winners, and we're so excited to be able to join you again next year, hopefully in person, to provide these awards and celebrate together. Thank you so much again for our recipients of this year's awards. We're so proud of you.
And Devin, the very best part is future award recipients we know are sitting right out there in our audience. And so we encourage you to continue to bring those innovations forward in the way that we've done today. And we just really look forward to your work.
All right, so Amory, I think it's time. What do you say? Say goodbye.
Okay, bye-bye.
Okay, thanks all, take care.
Thank you so much.
You rock. This award rocks. Thank you so much for all of your contributions to our field. It's so much appreciated. You totally rock. Thank you.
Thank you for all that you do. I appreciate you so much. Let's have a great conference.
We are so excited for you. Congratulations again. I hope to see you in 2022.
What I think is super, super cool is that you guys and gals did it during a global pandemic. Not an easy task. So thank you and keep up the great work.